mine's taken. I just didn't want another kidney.
I got you. You're right. Okay, so we get a lot of people who do not follow our long-term advice, and that's okay, but I probably would. One of the things we find is a lot of people stop taking their Tums. And again, obviously I'm not going to be at your house checking on you, but we recommend you continue a lifelong therapy of supplemental calcium, and particularly we like Tums best. And so what are the 3 reasons to take Tums? Let me talk about those. And in particular, I'm going to comment on the choice of the kind of calcium, why we like Tums over, say, the other forms of calcium. And we're going to talk about osteoporosis, kidney stones, and ulcers. So we've got a lot to bring forward for your interest in this video. Okay. With the gastric bypass comes some risks and complications. And I'm going to mention 3 of them because they're so concerning. There are more, and we talked about gluten insensitivity in one of the earlier videos this morning, but I'm going to talk about ulcers, gastritis, upset stomach. I'm going to talk about osteoporosis, weak bones, hip fractures, and I'm going to talk about calcium oxalate kidney stones. And I'm going to give you the quick answer, which is Tums help protect against all 3. So that's why we encourage it. All right, number 1, let's talk about ulcers. Probably the most dangerous, difficult, bothersome, annoying, serious complication of the MGB is ulcers, gastritis, or what we call marginal ulcers, which can progress to the most serious complication, which is perforated ulcer, bleeding ulcer, or even death. Okay? You don't want that. That's why we say no cigarettes, no alcohol. Remember there was the beer discussion? No alcohol if you take my advice. Okay? Now you don't have to take my advice. You can ignore what I say. Okay? I'm not going to come to your house, open your refrigerator, and see if you've got beer. Okay? But wait a minute, let me go back for a second and tell you, why do you come to see me in the first place? Okay? Why would it make sense? Why would I argue it might be reasonable to see me when you come from so far away? From Colorado, from Utah, from Canada, from... Okay? Why would it make sense to come from far away? Well, one is technically I'm good. In other words, I do this every day. I'm very technically skilled at it. Not because I was a natural-born surgeon. I wasn't like sewing laparoscopically in utero or anything like that. But I do it all the time, so I get good at something that you do a lot of. So people traveling to get technical skills in medical care is something that has a long history. But let me emphasize to you my opinion, which is one of the reasons it might be good to come and see me, is because over 6,000 people have my cell phone number. Okay? 6,000 people now have had the MGB, and they have my number. And they call me and they tell me about the complications that happen after the surgery, and they get ulcers, they get gastritis, they get perforated ulcers. And when they do, they call me. And when they call from the ER bed, or from the operating room bed, or from the hospital bed, and they say, oh, Dr. Rutledge, that's terrible, I have terrible pain, I had a perforated ulcer, this is awful, da-da-da, I talk with them. And I say, oh, this is so terrible, I feel awful about it, the surgery can cause ulcers. Have you been following my advice? Hello? Hello? Well, you're not drinking alcohol, are you? Hello? No, Dr. Rutledge, no, nothing but just, an occasional beer, glass of wine, whiskey, bourbon, tequila, and a couple of cigarettes a day, an hour, and I'm taking aspirin and Motrin. So we know what causes ulcers in my patients because they call and tell me. You want to spend $15,000 to $17,000, travel to see me, and then go smoke cigarettes and drink beer after the surgery? I'm cool, because you paid me, right? Is that smart? I'm telling you, this is a handgun. You can use the handgun to protect your house. You can also shoot yourself in the head. Be careful. The MGB is a very powerful tool. It can protect the house. It can cure diabetes. Can you imagine saying that out loud? It can cure diabetes and high blood pressure and high cholesterol and sleep apnea. But we're not in fantasy land. You know, Tinkerbell is not here this morning. We're not going to wave our wand. With this very powerful tool comes danger and risk. Drink alcohol, get a perforated ulcer. Let me say that again. Smoke cigarettes, perforated ulcer. You want a perforated ulcer? I can't hear you.
No.
Right? You want a perforated ulcer? No. No, you do not. You want a cure of your diabetes. You want to release from 150 pounds of extra body weight. You want to go from a size 22 to a size 8. Those I have to offer. But I'm not in Disneyland. I don't have a therapy that is free of complications. So my surgery has risk along with those tremendous benefits. I think it's a good trade-off. But if you think there's no trade-off, then I haven't educated you adequately. I haven't told you enough. Because this surgery does have risks. Okay. Now, you could get an ulcer. I don't want you to get an ulcer. So I tell you, don't smoke cigarettes. Are you smoking cigarettes?
I don't smoke cigarettes.
Huh?
No.
Absolutely not. Are you drinking alcohol?
Absolutely.
All right, good. Are you eating a healthy diet? Fresh fruits and vegetables and orange juice and things like that? Okay.
When it goes down, I have a hard time eating, period. But
Okay. And we should come back to that. Are you taking your Tums?
the last month, no.
Okay. Do you want a perforated ulcer?
No.
Okay. Why are we recommending Tums? We are recommending Tums because they are an antacid. Okay? And you don't have to take Tums. You can call me about the perforated ulcer when you get into the hospital.
I'll take some.
Can you hear me now? I can't hear you.
I can hear you.
Yeah, okay? So that's number one, but I'm not done. That's just number one. Okay? Let's go to number two. Long term, in the United States, we are suffering from an epidemic of osteoporosis. Weak bones, bones with inadequate mineralization, and then people who are in their 60s and 70s and 80s, the bone fractures, and there's a high death rate with those fractures in those elderly patients. Okay? It's a terrible complication, and every night on TV you see ads for bone building stuff, like Caltrate tablets, and Gidget, the flying nun, is taking Boniva for a new life and all these things. Okay, that happens in people without the MGB. The MGB interferes with calcium absorption and digestion, so you need to take Tums and calcium to increase the absorption of calcium into the gut and into the bones of the body. So number two, take your Tums for your bones. Okay? So last month, did you take Tums?
Last month, I took some.
Okay, this month?
No.
Okay. Do you want to have a hip fracture?
No.
Right.
I'll be taking my time.
Okay. But now, you're saying to yourself, well, he's such an annoying little man. I ask him about kidney stones, and he doesn't talk about kidney stones. All right, so let's talk about kidney stones. I'm going to talk to you about a very unusual chemical called oxalate. Oxalate is a chemical in foods. It's a metabolic side product of a few things in the body, and it's odd because it's insoluble. It mixes with calcium and forms stones in the urine. And if you eat a bunch of oxalate, you'll get a bunch of oxalate in the urine, and you'll get mixing with calcium, and you'll get calcium stones. And they are a son of a gun. Can I get an amen?
Amen.
All right. So I said you don't want a perforated ulcer, right? You don't want a broken hip, and you don't want a calcium oxalate kidney stone, right? Okay. So you might ask, how can we protect against them? Well, one is you could have less oxalate in the urine and less calcium in the urine. And so for years, doctors and urologists recommended eating less calcium to avoid calcium in the urine, and they found that that actually made things worse. So you want to take some extra calcium, and that will actually help protect you from kidney stones. Now, here comes the tricky part. There are different kinds of calcium. There's calcium carbonate and calcium gluconate and other kinds of calcium. And Tums is calcium carbonate, and it's less well absorbed than calcium citrate or Citracal. So you might say, Dr. Rutledge, why don't we take Citracal for better absorption? And the answer is, oxalate, I told you, is in some foods. Oxalate's in chocolate and spinach and some other foods. Imagine if you ate calcium and spinach or chocolate or other calcium oxalate foods at the same time. You might be able to bind the oxalate in the gut with the calcium, and it wouldn't be absorbed and help protect you from that oxalate. Since calcium carbonate is less well absorbed, it stays in the gut, and it's more likely to bind with the calcium and the calcium oxalate. So we like Tums, calcium carbonate, because it's in the gut more and better able to link up and protect you from absorbing the calcium, the oxalate. So for 3 reasons, we say, right, a little bit complex, a little bit of a long answer. Which of my answers are not long answers? But you know what I'm trying to say? I can't hear you.
Yes, amen.
Take your Tums.
Thank you.